I want to tell you about the regenerative therapies that we have here at Temecula Center for Integrative Medicine. And what I want to tell you about is what is regenerative therapies. And so regenerative therapies are multiple, some of which insurance pays for and some of which insurance doesn't. But the types of therapies that you may have heard of before are hyaluronic acid injections such as Synvisc or Hyalgan. Those are actually regenerative therapies. They aren't that effective, but they can prolong the time that somebody may need surgery. Other alternatives include ozone injections, plasma-rich platelets, or known as PRP, things like stem cells. Acupuncture is also a regenerative therapy. Plant-based nutrients, so glucosamine, chondroitin, sulfate, those things all help to support the body's ability to regenerate. The key for any regenerative therapy is that it's safe and effective. So make sure as you're researching different types of regenerative therapy that you pay attention to what the outcomes are, what the potential side effects are, what the risks are. One of the things that I pride myself on is that I really try and do things that aren't going to cause harm to the patient. Now, it doesn't mean it won't hurt a little bit along the way. Sometimes a little bit of pain is part of the healing process, but it shouldn't cause lasting pain or disability. And so regenerative therapies can treat chronic pain, decreased function, inflammation, joint pain, degenerative disc disease. They can even be used to treat cancer, immune dysfunction, autoimmune disorders, as well as try and improve or slow down the aging process. So let's talk a little bit about the regenerative therapies that we offer here at TCIM. The first is ozone. And you may be asking yourself, what is ozone? You may have heard it before, you may not. But ozone is essentially a 3-molecular gas, but it's pretty unstable. We actually have to make it here in the clinic, and we do that in an ozonator. This takes oxygen gas and splits it and then recombines it so that you get this 3-molecular oxygen gas, which is called ozone. When we inject that into the body, either in the blood or in a joint, it immediately disassociates into oxygen, which is the 2-molecular gas, which we are familiar with, and a free radical, which then can bind to water to make hydrogen peroxide or other things to oxidize and stimulate the body to release chemicals that are going to recruit the immune system, recruit growth factors, and recruit stem cells in order to repair and heal. One of the other effects of this oxygen-free radical and all of this oxygen is that bacteria and viruses are completely destroyed and damaged by it. Where mammalian cells have the capability of reducing oxygen into a safe component, so our cells are not damaged by ozone, which makes it a really awesome, safe tool to use in regeneration. So when we do oxygen therapy, one of the things that we look at is whether or not there's scar tissue involved, or to what extent there's been damage based upon degeneration or prior injury. And if we find that the joint or the area will benefit from just ozone alone, then we get that started. A joint injection with ozone usually stimulates the immune system for about 48 hours. So you may feel a little achy, you may feel like you re-sprained your ankle or re-sprained your knee, and that'll last for usually up to 48 hours. Not everybody experiences that, but a lot of people do. Then over the next 2 weeks, as the body has been stimulated to repair that area, then you're going to get healing factors recruited to the area, and that area will start to heal. Most people don't get by with just one ozone injection and need up to 8 injections before they're completely healed and have that area regenerated. So we like to repeat those injections usually 1 week apart, and then 2 weeks, and then push it out to 4 weeks, and we just monitor you to see how well you do. The procedures are followed by pulsed electromagnetic field therapy, and I'll talk a little bit about that in just a little bit. The next type of therapy that we do here is a form of plasma-rich platelets. So let me explain a little bit what plasma-rich platelets are. So these are platelets that are essentially extracted from the body and they're activated. So the activation of these platelets then causes them to release different types of growth factors. So the types of growth factors that are commonly released are TGF, VEGF, PDGF, and these stimulate the body to increase blood flow as well as to bring nutrients such as collagen and other things to reform and restructure the joint. So one form of the plasma-rich platelets that we do that's a little different than most places that you may research out is that we don't have a machine that spins down and separates the serum from the platelets. We actually take all of your blood and then we clot the platelets within the blood. That way it keeps everything together and there's rich components within the blood that we can add back in with the platelets. Now this process is we use a hula cup and we add the blood and there's a special micronized glass vial that ends up going in, and when that happens then that activates those platelets. Interestingly enough, Brown University did a study on this and compared the hula cup with other forms of PRP, and they found that there was a significant increase in the capture rate of platelets within the hula cup versus other PRP forms. Most get somewhere between 65% to 75%, and they found that they got up to 92% capture rate within the hula cup. And so you can see that we want to activate these platelets because there's multiple different types of growth factors that can be used to heal and draw in both stem cells and building blocks for this area. So when we give the plasma-rich platelets in the form of the clot matrix, we actually then add ozone to it to oxygenate that tissue and all those red blood cells that are in the blood, as well as stimulate the body further from a mild inflammatory response so that the body can really focus on healing. You know, for those of you who have torn your ACL or you've heard of somebody tearing their ACL, one of the things that really helps to heal that is the fact that the body bleeds and then you get this clot formed inside the knee. Well, we're kind of recreating a little bit of that injury by putting this into the joint. So the body thinks it's been injured and then it recruits all of these tools to help rebuild that joint. And that's really powerful because it doesn't require surgery. Now the stimulation part with ozone clot matrix typically is about 2 weeks, with the improvements in the repair and the rebuilding going on for another 6 weeks. So often we need to repeat the ozone clot matrix. We do that at the soonest 2 weeks after the first injection, and sometimes as long as 6 weeks. So the next level of sophistication with our ozone clot matrix is adding stem cells to that mix. This is where it gets really exciting and really fascinating. And the types of stem cells that are available on the market today are essentially 3 to 4 different types. So you have adipose tissue-derived stem cells where they have to do liposuction and then they extract the stem cells and then they inject those back into the joint. Or you have bone marrow-derived stem cells where they drill a hole into your bone, they suck out the bone marrow, they extract the stem cells, and then they inject that back into the joint. Or you can use umbilical cord stem cells. Now these stem cells truly aren't stem cells in the same kind of reference that I just made to the fat tissue and the bone marrow, because they're actually derived from the umbilical cord itself. So the umbilical cord tissue contains within the Morton's jelly, which is kind of the lining of the umbilical cord, these pluripotential cells. What that means is that they can stimulate stem cells that are building block stem cells to activate and become whatever the body wants it to become. So the really cool things about these umbilical cord stem cells is they don't have any proteins around them, so they don't activate anything in your body from a standpoint of an immune response in a negative fashion. Like we think about blood typing, we don't want to give somebody else's wrong blood type because your body reacts to those proteins on the surface and then that can cause a bad reaction. With these stem cells, you don't have that. The other really cool thing is about these stem cells is that they screen the mothers much like they would for an organ transplant, because this is truly a tissue transplant. In fact, we call this a biological allograft, which is a little different than actually stem cell therapy, even though it kind of falls in line with that. See, stem cell therapy is taking your own stem cells and putting that back into the joint. And what we're doing here is we're taking stem cells from umbilical cord and placental tissue, and we're stimulating your body to actually create your own stem cells to be active in rebuilding that area. So it's truly a allograft or a transplant into your own body. And the fascinating thing too is I think about, boy, as I get older, my stem cells are going to get a little more rigid. I'm going to have less of them. They're not going to be as able to multiply. But these brand new stem cells are like little kids. If you've ever gone to a party and you've been with a bunch of older people, everyone's kind of calm and nice chit chat, and then you bring some younger people in, and now all of a sudden the party starts to get livelier, the kids are dancing, and all of a sudden you find yourself dancing. Same thing happens with your stem cells, all right? So you add these umbilical cord stem cells in there, and your stem cells start to get excited. They remember what they were supposed to do, and they start rebuilding your joint. And so Dr. Riordan has done a great job of explaining more about this, and you can watch it on his YouTube video, How Stem Cells Work. And he's done some fascinating research into the stimulation of your own stem cells, and I'll let you watch that to find out a little bit more. But we found that we don't need to do as many stem cell ozone clot matrix mixture joint injections as we do if we're just doing ozone or doing ozone clot matrix. Most of our patients just require one injection. Sometimes they require a second injection. The stimulation that happens with these is about 6 weeks, which means that then the repair for the joint and the rebuilding happens over a course of 3 to 6 months. So it's much more prolonged. We're getting about a 70 to 85% success rate depending upon what area of the body we're injecting and using. And it's been just fascinating to watch. In fact, I've never done anything more fun in medicine in my entire life. It's really exciting to see patients coming in who are suffering and wanting to avoid surgery, and now they have an option. And so, in fact, we've had about 12 patients who were scheduled for surgery, and 11 of those have not gone to surgery. And the one person who did go to surgery wasn't really that great at following all of our instructions for rehab and nutritional changes and dietary and lifestyle changes. And so I don't think she had quite the benefit that some of our other patients have experienced. So I'm really excited for you to be able to experience one of these options. But the last thing that I want to talk to you about is pulsed electromagnetic field therapy. But before I do that, I want to back up and talk to you about the number of stem cells that we have when we're babies compared to when we're middle age and when we're older age. And so when we're young, one stem cell, because of how quickly it can divide and replicate and how much we're producing, will end up being 1 billion stem cells at the end of 1 month. Where when we get to be middle-aged, one stem cell will divide and double only to about 32,000 stem cells by the end of the month. And when we get to be age 60 or so, then we're looking at about 200 stem cells by the end of the month. And then when we get to age 60, we only get about 200 stem cells at the end of the month. So you can imagine, do you want those aged, decrepit 200 stem cells extracted from you and then put in another place of your joint? Or do you want these young, immature, excited, motivated, hungry stem cells coming from umbilical tissue to stimulate those few stem cells that you have left to really get excited about repairing your joint? And that's what we're seeing. We're seeing an improvement in function, we're seeing a decrease in pain, and it's just been absolutely amazing. So stem cells are really interesting. We take this biological allograft that we're getting from umbilical cord tissue and we inject it intravenously. When we do that, we stimulate the body's own immune system to respond in a positive fashion, releasing multiple T regulatory cells. In our body, we have different types of lymphocytes. And the policing factors for Th1 lymphocytes and Th2 lymphocytes are these regulatory lymphocytes. And these stem cells stimulate an upregulation. So for example, somebody who has an autoimmune disorder and they get an upregulation of one side of their immune function, it will actually bring things back into balance so that there's a decrease in inflammatory molecules, there's a decrease in the tissue damage, and there's an improvement in overall function. So one of the other things that it does is it retrains your stem cells how to function properly. As we get older, our stem cells get a little sluggish. So one of the things that these stem cells do is they help to reprogram or reactivate your stem cells that have been a little sluggish over time, may have been sluggish due to toxins or environmental factors or stress or whatever that's kind of disabled them. These younger stem cells can activate them. These actual stem cells don't get involved in rebuilding anything specifically in your tissue, so you're not getting new DNA. They just move around in your body and then they divide. So this 30 to 60 million stem cells that you get in your body will then divide to as much as 500 million stem cells over the next 48 hours, which is pretty incredible. We combine that with some B vitamins and some nutrients, and all of these things allow your body to really heal at a rapid rate. We've had fascinating experiences with patients, one in particular who had myasthenia gravis and rheumatoid arthritis. After his second IV infusion, went home and jackhammered for 3 hours because he had so much more vitality and energy. In fact, I thought his wife was going to choke him because here they were spending all this money on IV stem cell therapy, and he's home trying to get injured doing jackhammering. But it just goes to show how much better people can feel with this. Lastly, I want to talk about PEMF. PEMF is a great tool of using magnet therapy to help revitalize cellular tissue that's been damaged either through injury or degeneration. And it helps to repolarize the tissue in a way that stimulates the cells to rebalance. And more importantly, it helps the connection between the nerves and the muscles to be reformed. So people who are having peripheral neuropathies or having a lot of nerve pain or having spasms in their muscles, all of this can be healed with pulsed electromagnetic field therapy. And I feel so strongly about its effects that I combine it with every single one of my regenerative therapies. You can do PEMF by itself if you want, but every time you do a regenerative therapy with injection, you'll get at least 5 PEMF treatments associated with it. So I hope you've enjoyed this video. I hope it's been informative. And if you have any further questions, you can certainly talk to us more about it.